moving right into the Bronze Awards. We're going to start with the best classroom learning experience that goes to Amplify Tablet by Amplify.
This tablet belongs to Ms. Costa, a science teacher at Thomas Jefferson Middle School. Her tablet is organized around her schedule. To start a class, Ms. Costa just opens her notebook and presses a button. Jaden Combs is one of 30 students in Ms. Costa's second period life science course. With the Amplify tablet, Ms. Costa can see who's in and who's absent in seconds, saving her valuable instructional time. She can also see exactly what Jaden and the rest of her students are doing on the tablet. In fact, Ms. Costa can opt to block any or all apps on her students' tablets. Amplify is introducing a new way for teachers to prepare customized lessons with the playlist feature. For her lesson on invertebrates, Ms. Costa mixes content preloaded on the tablet with other resources from the web to create a playlist. She can save her playlists in advance and publish them to her students during class. Once in class, she can check her students' understanding with the quick poll feature. Here, Ms. Costa poses a true or false question and tracks responses in real time. For those students who answered incorrectly, Ms. Costa can resend relevant materials for extra help, putting differentiated instruction at her fingertips. After a long day at school, Jaden is at home, working on his homework. Ms. Costa has assigned her class a project to create a multimedia field guide about invertebrates. Science isn't Jaden's favorite subject, but this kind of creative, active assignment grabs his attention as he sets out to document the grasshopper for the field guide. After Jaden takes his specimen photo, he researches the grasshopper on the Britannica app and finds everything he needs to write his entry. Jaden puts it all together and submits his entry to the class. Suddenly, Jaden gets a reminder that he has a math quiz tomorrow. He launches the Math Maps app, which shows him which concepts he's mastered and where he needs to focus. Ratios is one area where he needs some practice.
What is the ratio of?
After watching a Khan Academy video, Jaden is ready to test his knowledge with an Amplify Ratios challenge. Upon submitting his responses, a congratulatory...
We're on a tight schedule, so we can't play the whole thing. Cliffhanger, you're gonna have to go to the website afterwards. So is Sean Farrell or Andy Clark here? So with this first award, I'm actually going to be giving the award. The others will be given by each of the jurors. I'm going to speak for the jurors. I didn't vote, as you know, but the jurors thought this was a fantastic submission because of its strong meta-organization of existing technologies into one simple and intuitive UI, and a great way to integrate the teaching experience across teachers and students through one unified platform. And it appeared to have a very robust and sophisticated feature set. So we were pretty excited to see how full-featured it was. And I'm wondering if the jurors have any questions or comments for Sean or Andy?
I'll say something in that. Just congratulations. This is a complex and difficult problem. And from your submission, it seems you've come up with a fairly straightforward and simple answer. I recognize that you're designing for a future that is emerging, so that's a difficult thing to do, and I sort of congratulate you for doing that.
One more? Oh, no, sorry. That was a different question. I'm sorry. Okay, well, Thanks very much. Our next bronze award, there's 3 bronze awards, by the way. The second one goes to the best clinical healthcare experience for PowerChart Touch by Cerner. Is Seth Claybrook or Todd Reynolds here? Please come on up while your video plays.
PowerChart Touch solution is a native iOS experience created to change the delivery of healthcare. We are creating mobile workflows that present the right information to physicians at the right time, increasing productivity. Our goal is to create efficient, delightful experiences. By observing physicians during patient care and repeated user testing, we gain an understanding of their needs and tailor a solution for them. Delivering the best-in-class user experience and fundamentally changing the delivery of healthcare. When the user experience is natural, technology becomes transparent, allowing the physician to focus on engaging and caring for their patient.
Congratulations, first of all. I and many of the jurors, I think all of us, have been waiting to see something like this for a long time. I know, John talked to us about the future of healthcare UX. You guys are really out there and doing it. And the reason why we thought that you're more than deserving of this award is because of several things. I mean, first, there are a lot of people that are in this space. Your team took a holistic approach. You didn't just look at your users, you didn't just look at your business, but you also looked at your technology, and you were able to create a solution that made physicians more productive and healthcare better, which ultimately benefits all of us patients out there. So thank you very much. And so I was kind of curious, because this was such a holistic approach, which part of the effort from conception to kind of shipping to creation was the most critical in creating such a great user experience?
I would have to say probably the performance issues. Because of the architecture and technology, doctors need to have this information fast, right? And to be able to have all the data crawl and all that technical stuff, that it doesn't matter how transparent the UI is, how easy it is. It takes forever for those medications to load up on that profile. they're just gonna set it down and go right back to the old technology that they had before because they knew how to use it and they were comfortable with it. So, performance is a huge issue that we currently
That's awesome. That's really good back on TV, but this isn't. Congratulations again. Jurors, anybody else have any other comments?
What is the most powerful thing you can say to a physician's office that they would say, wow, I really want this product?
I think I can go back to some of the stuff that was shown here. We highlighted being able to place those medication orders very quickly and very easily so that document can be created for them so they don't have to stay 3 hours afterwards trying to get all that paperwork done. That's huge for the physician, and that's really powerful.
Thank you very much. Congratulations. Okay, our last bronze award goes to Water for People to reimagine the reporting platform for the most persuasive use of data by EffectiveUI for client Water for People. Is Amanda Gagliardi here? Please come on up while your video plays.
Within the next 5 years, where Water for People works across 30 districts in 10 countries, we want every family, every school, and every health clinic to have reliable and affordable water and sanitation, and that these services will last for generations to come.
Ned Breslin from Water for People here, and I'm so excited. We just launched our Reimagining Reporting platform. So Water for People does an enormous amount of monitoring around the world. We also look at what we're doing well and what we need to improve on. But that information's all over the place. It's in reports to donors, it's in lessons learned documents, it's scattered. And it's usually written up, which is not a particularly good way of sharing information. It's not a particularly good way of learning. It's not a good way of inviting people in to help solve problems or challenges that we're facing. So we created this great platform that allows us to put all of our programmatic data openly, clearly, visually compelling, and see what we're doing well and what we need to improve on. It combines that with the goals of our program, so you can see, are we getting closer to the results we're shooting for, and what are the challenges that we face? It combines it with the finances that we're allocating, and the finances other organizations, other governments are putting into this program, so you can see what it costs. And it creates an opportunity for staff, for partners, and for interested parties around the world to begin to contribute to discussion on how to make water and sanitation last.
Our approach on the design side was to really appeal, because in the end, we're all humans, we all kind of appeal to our senses. So whether that be tactile, auditory, visual. So our approach was really to kind of combine both of those, to take a look at ways that we could take a lot of complex data that is custom and be able to present that in a way that is really compelling through data visualization, and it allows people to interact with the data. And then on the other side, there's the human interest side, and there's more the emotive side, and really being able to take donors on a journey to really see the impacts that their contributions are having, not just at the field level, but also looking at it from the beneficiary level and bringing those stories to life. So that was a very powerful, and we believe will be a powerful combination to combine the two.
It's inviting, it's powerful, it's based on the way that people learn and share ideas. Join us, look at it, and help us solve this problem.
Data visualization is kind of a buzzword. A lot of people spend a lot of time thinking about that. I think there's a lot of, there's kind of a lot of the design porn aspect to data visualization these days. And that was absolutely not the case here. The data visualization here was perfectly executed, but more importantly was coupling that data visualization with the qualitative aspects of the actual human stories in each one of those regions. And you saw a little bit of that in the video, but seeing it, and I think as jurors, when we looked at this, we think there's some very smart design choices made, literally about how really those pages were laid out to couple the quantitative aspects of the transparency and what the organization was trying to get across with really creating a human story and making that very real. So there was a really great experience, really great execution, and a really great holistic product. Kudos to you on that. But one question for you, with the submission, looking at the timelines, it sounded like from your submission that you were right around the launch time or so, right before it. And considering that now we're in May, probably about a month or so, I think, post-launch, if the dates are correct. What kind of metrics, what kind of information do you have to share about how well this has gone, what the uptake has been, how positive this has been?
So it's been received very positively. I think that people really love the fact that they can see where money is going, how it's really affecting communities, and then the story of what that effect does. As far as the hard metrics, I don't have them yet, unfortunately. I think we all struggle with that problem in our job of like when we get the numbers. But it's really exciting. And one thing I don't think that this talks about is what's really interesting about this is we went directly to prototype, and we just wanted to get the prototype out there and like let people use it. So like part of this journey that we're on now is like letting that evolve by having real people use it and interact with it and then taking it to the next level.
Any other comments from any of the jurors? It's a quiet jury tonight. Well, thanks very much. Congratulations.